I'm going to start by setting things up here in the computer. So I've just entered into this screen here, into our system, into our image pilot. So now I need to put in the information. So for patient ID, I'm just going to make one up, but you would use the appropriate patient ID for your PIM system that you would identify the patient as. And then the patient name, I'm just going to write, we're going to name him Mock, where we know that this is just a practice, and then we'll just label this Joe Blow. That's our practice file that we have here in the clinic. For gender, I'm going to select that it's a male. I'm going to select that we have a canine. The body type we have here is going to be a small canine. The braid, we're just going to call it a crossbreed hair. We don't need to fill this information out, it doesn't change, but we can put black. It doesn't need to be registered. Select the doctor. I'm working with Dr. White here today. The technologist, my initials. We can make up a birth date. And then we could fill this information out if we needed to, but all of this information we would have in our PIM system, which is Avamark. And then we need to press perform exam. Okay, hi, my name is Sam Kipp and my student number is T00698764. You're the clinical mentor, Dr. White. We're going to be taking abdominal x-rays here of our patient today. We're going to be taking two views. We're going to be taking a view from the right lateral position and a view from the ventral dorsal position. First, we need to clear our PSP plate, making sure that we don't have any static on the plate. We're working with a CR system. I've already pulled off the covers on my CR system here on my processor and on my unit itself. So what's happening with the CR system is we take a radiograph with everything on here later, and what's going to happen is we're going to end up getting an image sent into here, and it's going to become a latent image, and it's going to store photons, and it's going to have the latent image in our PSP plate, and the latent image is going to be put into our processor, which is how we're going to get the image from the latent image on the PSP plate into our digitalized system here. So what we need to do is we're going to put it in, and then it goes through the machine, and it's going to take a laser, will take the photons, and it'll take the photons into electrons, which is going to turn it into light, and then from there we're going to have it turned into a digital image, and it will be sent over to our computer here, stored as a digital image. But before we do any of that, we need to make sure that we actually remove any static that may be on this. So we need to take it and put it into our processor to prepare ourselves. So it's going to say ready here for me, and then I'm going to press it here now. You can see that it's blinking, and then it's saying that it's busy, so it's just erasing the image here now. We're just going to wait a second. While that is processing, we can measure our animal here. Alex, my assistant, to hand me the collimator, please. Thank you.
Calipers.
Calipers, yes, thank you. Collimator's up here is looking at where it's hanging. So, just taking a measurement of the widest aspect of our abdomen, you're going to see here, it's going to be around 7. Just over about 7.5. So I'll hand this back to you. Thank you. So now I need to be looking here at my index. So on my index here, we're going to be looking at the abdomen for about, we're going to go to 8 because it was just over 7.5. So it's 68 will be, this is going to be our KVP. And this here, the time, is going to be 1/60th. And the MAS will be 300. Okay, so we've got that all set now. So now we can take this out. It's saying ready. Left side has to be up. We slide this out and put it in there now. And then we just lock it into place like this. Our image is now, our PSP plate's now locked in. So now what we need to do is we need to make sure that we're on the correct patient. This patient's name is Mock, and we need to be on where the CR is. So that's where it needs to be. And then we need to be taking, at this point, turning the machine on and adjusting our settings. So I've got my fire protector on, I've got my gown on. Dr. White has the same there with his fixed his shoulder sliding off of him a little bit. Okay, so now I need to turn this on, and I'll have to adjust my settings. So as you can see here, the abdomen needs to go into 300 because of the size of the dog. My index says that, and then 160 if it's already on there, but to change it you can just go like this. And then we need to be doing the KVP. So the KVP is going to be at 68. This is the major, it turns up in higher intervals, and then you can play with this and get it to come up in smaller intervals, just like so. So, and now we're on the correct patient. The CR on this has to be blue. So see how I clicked just like this to make it blue. So now we have the collimeter on. So we need to position our patient. So we'll start with our right lateral radiograph. So our markers here are going to be at our 8th rib. So we would count backwards, start at your 13th, count up 12, 11, 10, 9, 8, get to the point there, and then you need to make sure, so you feel the rib, and then get to the greater trochanter, which is the point of the hip, and that's the area that we need in. So that would be our collimation field essentially. So this is how you would adjust your collimation. Now it will only go, as you can see here, it will only go so small. So that's about as small as I can get it to go. Or no, it will go smaller, sorry, ignore me. But now we can see here, that's where the collimation starts. Collimation is ending right about here. So that's about where we need for the collimation field. And then we can take it down a little bit this way, because we don't need to have everything exposed out this way, and taking it down will decrease the scatter that we have. So that's important to do there as well. So that's about what we need. So we're about good there. And then we're right lateral. So we're going to put the marker on here. So this is the right. And then what we're going to do is we're going to put our gloves on. Making sure this is on here, which it is. And now I'm going to ask my assistant, we need to pull the legs back, please. So we're going to pull the legs towards you caudally, and I'll pull this part right here. And we just want the R to be exposed. Yeah, here we go. That'll work. And we want to make sure too that the spine here is going to be nice and straight. So our spinal processes will be all in line with each other, all parallel. So that would be pretty good. So now what I would do, I'm not going to actually do it, but what I would do is I press down on our foot pedal here, and our foot pedal is going to start to generate, and then what we're going to do is we're actually going to press down on it after about 1 Mississippi. So basically we're waiting until a few seconds have passed by, and then we press down on the foot pedal, and then on here it's going to say, on the red here, it's going to flash, and it's going to say that we've taken an exposure. So that would be the first one. The important thing is when we're actually taking the exposure, so we're going to pretend like we're taking the exposure now, is that Dr. White and myself, we're going to be looking away and turning our bodies away as much as we can from the patient and from the exposure, so that way we get less scattered exposure. So we're holding on here, it's great. And then our patient's fairly straight. We're going to be pressing down now, look away, turn your body away. Okay, pressing down and holding for a few seconds. Okay, then pressing down fully, then the exposure is actually taken. Okay, now what we would need to do for this is we would take out, so if you can just stay with our patient so it doesn't leave the table. We take out our PSP plate. The latent image is now stored in here. I'm going to come out a little bit this way. Now one more thing to note, I'm doing this video so you can see me with the light on. If we were actually taking the radiograph, our light would have to be off. So now, I need to, I'm not going to actually do this because we didn't actually take an image, but what I would do is I would load this PSP plate, arrows towards the insertion point here, and I would load it directly in until it locks. and then we would wait until it processes. I explained the processing process earlier, and then it would actually go on. Within about 60 to 90 seconds, we would actually see an image come up on here, and that would be our radiograph of our right lateral position. So then, what we would want to do from there is this processor actually erases the image because it's taking the latent image actually out of it and erasing it so we don't get the static. So now I don't need to erase it again, but I do need to flip it over black side up. It goes back in here like this. We're going to need to lock it now. And we're taking our next image right away. We're ready to go, so we're just going to reposition our patient here. So we're going to be turning our patient into a ventral dorsal position. So you take the back legs and you're going to need to extend them back. Now I'm going to make sure I'm holding onto the sides of the head here, and we're going to look at our collimation here again. So we want to make sure our collimation field is going again to about here and about here. So we're getting from the 8th rib all the way to the greater trochanters again. So then what I would do here now is we're in a good position here. So what I need to do, I'm not changing our settings at all. I'd be pressing down on our foot pedal again, waiting a few seconds, and then fully pressing down to take the image. And then we would be all set there. Now what I need to do is I need to take our PSP plate out because the latent image is now stored in it. Now we're not going to be taking any more radiographs right now. So what I can do is I can actually turn off. Turn the collimation off as well. And then we're going to take our PSP plate out. Really important to be careful these, don't drop them. And then it says ready. You can see the arrows in here. We would put it in here to be processed again and explain how that works. And then we would go over and actually take a look at our computer and see that we're happy with the image. So that's how we would go about that process. So then we would have those two images taken. Okay, so explaining an automatic processor. For an automatic processor, that they're actually used for film. The difference between using an automatic processor versus processing yourself is that you actually have to take the image yourself into a dark room, and when you're using it in the dark room, you're actually inserting the image into the developer and then into the processor, and then also into your rinse in between and afterwards. So you're actually physically doing that yourself. It takes about 10 minutes. Whereas the processor, the automatic processor, actually kind of the same thing as what we have here. You'd have a top to it though, and what you would do is you would insert your image, same as you did here with the cassette. You'd insert your cassette, and then in the processor you would close the lid, and once you've got it inserted. The important aspect of this too is that for the processor, that you're not shoving it in kitty corner, that you're shoving it, that you're gently placing it in directly, and that we then close the lid, and then it will go through the process. You have all the chemicals underneath here, and you'd want to make sure that they are all full, that you have your developer full, your rinse full, your processor full, all of that is ready to go, and then it would go through, the cassette image would go through, and it would be processed with all of those chemicals, and it would come out the other end. You want to make sure it's got a little bit of a drying rack on the other side. When it's coming out the drying rack, don't pull the image forward, even if you're anxious to see the image, because if you're pulling it forward, you can be destroying the image as it's drying. But that's the difference between using an automatic processor versus doing it by hand way, or by using the processor for the CR unit, as they explained. With a digital unit, you don't actually have to change the latent image into a digital image by using a processor. It actually connects directly without a processor to your computer. Everything is done within a built-in plate. The plates are actually built directly into the table. You don't actually have a cassette where you need to take it in and out, and everything from the latent image all the way through to the digital image is all done through the plate that's already in the table. There's no processing involved.